Good morning, everyone. Thank you for joining us today. I'm Dr. Velasquez, the Health Officer for Spokane County. And today I'm joined by Sasha Mowini from Catholic Charities Prepares Program. And if you were paying attention last week when we talked about postpartum depression, you remember that Alicia Kreitzer from our team here mentioned the Prepares Program. So we thought it would be a great idea to have a follow-up conversation with you. So thank you for coming.
Thanks for having me.
So since we just mentioned briefly the program last week, maybe you can tell us a little bit about what Prepares is.
Yeah, so we serve families from pregnancy through the child's 5th birthday.
Okay.
So really our big picture goal is about supporting the parent-child relationship. Our mission statement is creating hope, strengthening families, and transforming generations. We do this through a lot of different avenues. First, we like to focus on reducing parental stress through diapers and clothing and other items distribution. We also focus a lot on parental education. We offer Circle of Security parenting classes, also a baby care class and a toddler care class. And then we also just like to offer support. We have a mentorship program it's called our Family Companions program. And then we also have a social support group for moms called our Prepared Moms. And they meet on Thursday mornings at 9 a.m. or 10 a.m. till 11:30. Excuse me.
Wonderful. So you can work with the family up to the age of 5.
Yes.
Wow.
Yeah, and so if the family has another child, then they just continue to be a part of our program. Mm-hmm.
Got it. Okay, well, that's an important point because many of the programs are more short-term.
Mm-hmm.
And up to the age of 5, formative years, that's really, really important.
Yeah.
So since we talked a little bit about what you do and what your team does, why is that important to the community? What should the community be aware of?
So we really look at the long-term impact. So, we know that healthy and informed and well-supported parents have healthy and securely attached kids.
Yep.
And then those kids grow up to form healthy attachments of their own and have supportive relationships and supportive friendships. And so that's the transforming generations part of our mission statement. We also just know that connection is super important for everybody for their well-being. And so we try to do that through all of our different programming is really aimed at not just giving you what you need in the moment, but meeting you where you're at and really engaging and connecting with our clients. That's our goal.
So you've mentioned sort of like a broad range of programs. What are some of the most critical programs or most successful programs or more important programs that you want people to know today?
Well, if I'm going to highlight a program, I would definitely highlight our Prepared Moms social support group.
Okay.
That's so it's an open group, and so we do have new members come every week, but there are a lot of moms who've been there and been going for years. They're so welcoming. So every time there's a new person that comes, they just are so excited to engage with that new person and get to know all about them. And we really focus on supporting each other through what's hard in parenting, but also celebrating each other's successes.
Okay.
And that group has grown really just secure in their relationships with each other. They've exchanged phone numbers and they're on a text chain and they get together with each other outside of our group. And so that's just been a really special thing to watch.
So they're basically building a community around the mother. Basically.
Yeah. And they've done that on their own. So, and that's been really special.
Okay, and I'm sure those relationships will continue regardless of whether in the program or not.
Yeah.
So, question that I have is, so we have a heterogeneous community.
Mm-hmm.
We have different languages, different ethnic backgrounds, different perspectives. How do you address that?
It's always, particularly with language, that's always tricky. And but we focus on trying to reach people in rural communities through a lot of ways. We've got Prepares has ministries in several different parishes in all of the rural counties within our Eastern Washington area. And we have a Spanish-speaking, she's an employee, she's part-time employee of our program who partners with all of these different parishes and works really hard to engage with any Spanish-speaking families. We also have a lot of volunteers, and so like that's the other thing is that this program is so volunteer-driven.
Okay.
So we have volunteers in all of these different counties who often will drive supplies or diapers to families if they lack transportation and can't get to a diaper pop-up. But these rural parishes will offer diaper pop-ups, offer clothing and warm coats. We also have a translation service that we use in our office at our family center here in town. And so when we need to engage with families who don't speak English, we will bring them back and engage a translator and try and get their needs met any way we can. I think another important thing to notice is that we serve all. We don't ask questions. We don't income screen. And so if you come and you tell us you need diapers, we're going to help you.
Got it.
Yeah. Above all, we really try to be culturally humble and lead with curiosity and acceptance. And we're also just always trying to be reflective about, this or that new policy that we want to try. How is that going to land with members of different populations? And we try to just ask a lot of questions and just be really reflective and curious.
So this, let me highlight a couple of things that you said that I think important for people to remember. One is this is not just Spokane County.
Correct.
It's Eastern Washington.
Yes.
And I think that's important.
It's actually statewide. We have connections statewide. Mm-hmm.
Okay.
Yeah.
So doesn't matter where you are. You can take advantage of that.
Yeah.
Second, it's not just about quote unquote the program does, but the people that participate in the program, like this community that is being built around moms and so on and so forth. So that's very important because I think community-driven efforts, and we're going to talk about volunteers in a moment.
Yeah.
Because I want to add that in, but that's a very good model of doing things. And then last but not least, don't let language or ethnic background or culture get in the way of getting help that you may need.
Right.
Because you can help, and if you don't have someone, you'll find someone. There's always a way to address it, right?
Yes.
And I think that's important to know because sometimes people say, well, not for me because A, B, or C. So don't let that get in the way.
Right.
We've mentioned programs and communities and volunteers a number of times. So I usually like to ask people, what can the average person in the community do to be helpful to these programs?
Well, so our staff, our local staff, is built of 3 full-time members and 1 part-time staff member. And so that does make it really tricky to do things like, in the last 90 days, we have given away 21,000 diapers to families. We've served 700 families in the last 90 days through diapers, clothing, and formula assistance. And in 2025, Prepares served over 8,000 families through the Family Center and other parish ministries across the 13 counties of Eastern Washington. So, that's a lot of community engagement to get out of 3 part-time staff, or 3 full-time staff and 1 part-time staff. So we really rely heavily on volunteers. And also we're donor-driven too. We lost a bunch of federal funding for diapers. So we're always looking for diapers and donations of wipes and formula. We often have families coming and looking for those things. Diaper need is an under-recognized social indicator of health, and diaper lack can affect families in just devastating ways. It can lead to children not going to daycare and then parents losing jobs, or children going to daycare in dirty diapers and then getting CPS involved. So, having diapers is really important for families, for their well-being. So we're always looking for volunteers for our mini programs, but especially we've got our family companion program. We're looking for mentors right now for that too. So if anyone is willing or interested in contacting us to come and be a part of our mentorship program, you'd get paired with a mom who's new to parenting and could use some extra support. That's always something that we're really excited to offer to the community.
Well, I appreciate that. So if someone needs your services, how do they get to you?
So you can reach us by phone. Do you have our contact information?
We'll put it up.
Okay, perfect. And so we can reach our front desk by phone. You can email us at prepares, help.frontdesk. East dot
We can put it up.
yeah cceasternwa.org. Sorry.
Wow.
Yeah. And then, so that'd be the easiest way to engage with us. And then we can connect you to the right department, the right staff member to get the needs met.
Okay.
Yeah.
And as you were talking, I was trying to picture 21,000 diapers.
Yeah.
It's
20,
like
yeah.
half this room over here.
Yeah.
That's-
21,000 diapers. Yeah. It's
Wow.
like stacks. Yeah. We have stacks and pallets. We order them by the pallet.
Wow.
Yeah.
Well, I think a lot of information, so I'm going to ask people to make sure that they go back and review everything you said and also share it, because we all know someone that is a new mom is going to be a new mom. We all know families with children or small children, maybe a child on the way. So just share and, go and check it out, and you may find something that is useful to someone in your circle. Any last piece of advice that you want to leave community with?
I think that we love to help. We love to engage. I mean, even if you feel like you have enough money for all the things that you need, if you need connection, we're so excited to have you come and be with us. And I mean, just piggybacking off of, engaging with us, if you're struggling with those first few months after birth, like, just connection can be such an important just strength that you can build for yourself. So anyway, come and contact us. Even if you really have all of your needs met and you just need people to be around you, come and engage with us.
Wonderful.
Yeah.
I want to ask you a question about diapers, because
Yeah.
that's something that people ask. So it's not just newborns that wear diapers.
No.
Diapers up to, as you mentioned, all the way to, pre-K or some of the child
Yeah.
care. So you can provide people with diapers from all of those sizes. I know a little bit because I have grandkids, and I know they're not all the same.
Right, yeah. So we have diapers up to size 6. And so, I mean, a lot of times that's like a 2, 3,
toddler, yeah.
4-year-old who's just about ready to be potty trained. Yeah, we still have diapers for you.
Good.
Yeah.
I wanted to clarify that because I don't want people to think that it's just for like the newborns.
Nope. Yeah, we have them.
Well, I want to say thank you again. A lot of information. I'm glad that I will take credit for the idea, although it wasn't my idea. I think our team here thought about the connection with the program we had last week. But I want people to go back, take a look at it, share the information. If you have any questions, there's an email that we'll put. So you can
Perfect.
send your email, and they'll point you in the right direction. So thanks for everything you do, and I agree. If we can help that transition from birth to the first few years of life, we're probably improving the life of a community by improving the life of a child one at a time.
Yes.
So thank you again, and we'll
Yes.
see you everybody next week. Stay well, stay safe, and we'll see you next Wednesday. Thank you.
Thank you.